You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, immediate tooth replacement with dental implants. With us, we have an expert on the topic, Dr. Lazarof. Dr. Lazarof, welcome to the program.
Thank you. Thanks for your invitation.
Now, people need to know this is a real interview, and I'm trying not to side with you today, but people literally fly from all over the world to get their teeth from you. Is that right?
Yes, that's correct.
Okay. Now, for people that don't know your practice, who's your typical patient, and what are the different services you offer?
The typical patient is someone that has lost or they're in process of losing their teeth.
Okay.
It's a difficult process where you go through, and it gives you, a lot of patients have psychological problems associated with losing their teeth. So you start feeling older and depressed, and you've gotten to other implant centers and they've given you the news that you have to remove your teeth, possibly wear dentures as a temporary measure, which is going to be for months.
You don't like dentures?
No, I think dentures are a failure of dentistry.
Okay.
This is what we had to do when we didn't have the immediate implants. So for me to prescribe dentures, I feel like it's a failure. And I feel like I can take the world out of dentures and even prevent them from becoming denture wearers. So the good news is that these patients that walk in, they hear the news that they can have their teeth replaced immediately. Now, a typical patient, when they hear about dental implants, they assume that it's immediate.
Okay.
But when they go to a dentist and somebody tells them the process, that's where the bad news comes in, where it takes months and months, and you have to take out your teeth, let them heal. You got gum grafting, bone grafting, all these surgeries, and then months later, if everything works, then you can have your teeth. But 25 years ago, I invented this process that puts that aside. And
so it's immediate, it's not just lip service.
It's not.
So you could walk in without teeth.
Absolutely.
And walk out with teeth.
Absolutely.
Is that right?
Yes,
okay.
I'm talking about a single tooth, 2 teeth, 4 teeth, 5 teeth, and entire mouth. Typically on entire mouth cases, we put them to sleep. They wake up and the entire upper arch is done. Another appointment, they go to sleep, wake up, the lower arch is done, and a couple of weeks later, we give them the final crowns. And when they wake up, they have temporary crowns, which are aesthetic and they function. They can actually go home and eat with them, but they don't last long. So we have to replace them with the porcelain teeth. And that happens about a couple of weeks later.
Now, my program airs all over the U.S. and all over Canada.
Yes.
And when we have dentists on the show, and the dentists that I know, you are known in dentistry.
Yes,
I mean, you're a pioneer of this implant. Is that right?
Sargon implant.
You kind of invented this implant. Is that true?
Not kind of. I invented this implant 25 years ago.
Okay.
And the whole concept of it is, initially when, I attended implant classes, typically it's a screw, a cylindrical implant where you place it in bone and it needs a healing time.
Okay.
And the healing time is for the bone to grow and attach itself to the implant, to the screw. But 25 years ago, I came up with the idea, what if we designed a screw that expands, just like a molly bolt, and locks itself in bone?
Molly bolt, you mean what you like hang art with?
Exactly.
And there's no beam on the wall.
Exactly.
Is that right? So
yes,
it works that way?
The idea is the same. Of course, the design is a lot more critical for body to function, and it has to be certainly designed that bacteria cannot go through it or anything.
Okay.
But the whole idea is an expandable screw that goes in and locks. And the question was what happens to the bone when you expand this screw? And we were surprised to find out not only that you can put a crown or a temporary crown on this implant immediately in full function, but with years down the line, because this implant is putting pressure on bone, a few months later you see the quality of bone is
So they're
improved.
strong, they're solid.
Yes. And
you could eat whatever you want?
Normal diet. Now, when you say whatever you want, I'm a little scared because I used to say that, and one of my patients started opening up beer bottles with it. Actually broke his jaw.
Oh, wow.
So,
okay.
no beer bottles, but normal food. Yes.
So replacing missing teeth with dental implants, that's the future of dentistry.
Yes. I believe there should be no one that we get to a denture level. Now, we have a lot of denture wearers that we treat, and if you're wearing a denture, I want to get you out of it.
Okay.
And I'm not talking about just locking your denture in. Obviously, if the patient is older, we're not going to put them through bone grafting surgeries and all that. There's methods that are acceptable for those patients, which is basically locking their patient in, the denture in. But if you're young enough and you want your own teeth back, we'll give them back to you.
Now, because you're the inventor of the Sargon implant, right? You've done more of these Sargon implants than anybody in the world. Does it cost more to go to you?
Actually, no. When you add up all the costs that is involved with regular implants, I mean, people think of just the implant cost, but when they're hit with the bone grafting, gum grafting, all that goes with it, this is much cheaper because when I place this implant, I'm preventing that loss.
I mean,
same day.
I mean, just some of the people get same day, or most of the people get same day?
This is a very good question. Over 90% of people get the same day. It's not a trick to just bring patients in and say, hey, we can do immediate, but it's risky.
Okay.
Risky, you know, it's risky. You can't chew with it. You know, I have a car that has no engine. I'll give it to you. You know, but this is actually the only implant that is FDA approved with an expansion mechanism that can lock, and it can be immediately loaded. Now, the term immediate load was coined by me in an article that I wrote in 1991.
That just means getting your tooth back in the same day.
Same day, same time that you take it out.
Seems very painful, by the way.
It's surprisingly not. Now, on patients that come in my office, obviously I'm not going to say you're not going to hurt or anything. I make them comfortable. I assure them that they're going to be numb during the procedure, and they don't feel anything. What is surprising is post-surgery, and most of these patients report that they go have a normal diet. Now, bone itself is just like nail and hair. It doesn't have too many nerve endings to hurt. So, and we've noticed that when you place implants in the socket, when you take a tooth out, when you place an implant and put pressure in that site, it has much, much less pain than when you just take a tooth out and you have a hollow socket.
Okay.
So that by itself, it reduces the pain. And as I said, most patients report that the same day they went and had a normal diet, food.
Okay.
We give apples to the patients right away after the surgery.
Is that
to
right?
Bite on. Yes.
So they come in without teeth. You get the teeth the same day. They could bite an apple. Is that right?
Exactly. No teeth or loose teeth that we do the procedure on.
Now, we talked on the phone. You said your typical patient is a person, their mouth is a mess, and they don't want a denture. They're trying to avoid a denture. And
Yes.
you say you're transforming people's lives. Tell me about that.
Yes. I'll give you an example of this patient. This is a typical patient that comes to my office.
Oh my goodness.
This is the teeth that this lady has. As a matter of fact, she is a singer, and she'd been all over the world. She lived in Europe. She'd been all over the world, and she came to LA and actually researched the idea of implants, and she was terrified. And she told me the idea of having my teeth taken out and having temporary dentures. They told her you have to take out all your teeth and wear dentures for months. And we do all these gum surgeries and all of that, and bone grafting, and the process should just unbearable for her.
Okay.
Until she found me, and what I did is every tooth that I removed, I replaced it with an implanted tooth. So we did it in segments, but she was never with dentures or with no teeth.
Wow. Very nice.
These are actually the closest thing to your teeth. These are natural teeth, actually stronger than your teeth because the substructure is metal. It doesn't decay. It's not susceptible to decay. The color of it is aesthetic, and we can make it any color and shape we want. So actually, we design smiles for people. You know, people that are losing their teeth, they've grinded their teeth, the colors have changed and all that. So we can improve that in one shot, and they just walk out with a beautiful smile that is functioning and comfortable.
So you spend a lot of time with these people that their mouths are a disaster.
Yes.
And I mean, could somebody be too far gone where you can't help them? Like, for example, bad gums?
No, as long as the teeth are there, this is the reason I'm concentrating on people before you take out your teeth. As long as the teeth and roots are there, they preserve the underlying bone, which we need for the implants.
Okay.
Once the teeth are gone and you start wearing dentures, with time the dentures put pressure on bone, and the bone becomes less and less. At a certain point, you don't have the option of placing implants and putting solid teeth on these unless you do the bone grafting and tissue grafting. So that's why I said if you're young enough, you go through that process and we still give you your teeth back. But we want to prevent people from going to dentures, losing their bone, and then later on have to pay for the gum and bone that they never had to lose.
And get it done immediately.
Yes.
Because nobody likes going to the dentist, right? Do you hear that? Do they tell you that?
That's number one reason.
Like, what do they say?
No,
like, no offense, doctor.
Doctor, you know, we love you, but you know, dental office is not our favorite place. And my reaction is, it should be. After what I do, I think you should wake up in the morning and say, today is a great day to go to Dr. Lazarof.
Get your tooth fixed on your lunch break. Details on a new procedure that will have you in and out of the dentist chair in no time. The 1-hour tooth replacement, it's true.
And now, Fox 6 Family Health.
An FDA-approved tooth implant system has transformed what has always been a 4 to 6 month ordeal into a 1-hour procedure.
Health Watch 3's Dr. Tom Hopkins has more for us. Dr. Tom?
That's right, Sarah. Adults who needed new teeth traditionally had to wait weeks or months to get a new implant. They didn't want to walk around looking like a hockey player who'd been hit in the mouth with a hockey puck. But now the FDA has approved a new procedure and allows people who need new teeth to get those teeth in 1 to 2 hours.
So people that come in, if all their teeth have to be extracted and you give them the dental implants with teeth on top, how do they take care of it? Just like regular teeth?
Yes, yes. Now, these are teeth, brand new teeth. It's the third set. First two sets were for free. Third one they paid for. Okay. And hopefully they take care of it better. You have to floss and brush just like natural teeth.
So how old can you be to get this done?
I had a 94-year-old guy that came in with his son, and my first reaction was to, you know, he was losing all his teeth and his upper teeth. And my first reaction was, I gave him the option of, you know, possibly a denture, and he got very mad. And he said, I specifically came to you because all this talk about your immediate implants, and that's what I want. And I said, this guy, my son is a doctor, I paid for his education, and he's going to pay for my teeth. So actually, he's the guy that we put him to sleep, and when he woke up, all his upper teeth were taken out. We put implants, and temporary crowns. These are the final crowns.
That doesn't look like a 94-year-old.
You know what? This is the reason. If you have your bone and structure in your teeth, things don't shrivel up as you typically would if you didn't have it. So you really didn't have those wrinkles. I mean,
but those teeth had to go. This was a 94-year-old.
Yes, the broken bridges, broken. He was wearing bridges, and the teeth were broken. And we extracted the teeth, and we put implants and exactly a bridge, just like you see in the picture. But that was a temporary one at the surgery time of surgery. Okay. About 3 weeks later, we gave him the final crowns that you see.
So people like this hear about you. I mean, you have a radio show.
Yes.
On the internet.
Yes, and also I get referrals from dentists. I mean, if you go to a dentist and he's familiar with our technique, and if you push him and say, I want my teeth right now, I don't want dentures, eventually they'll say, Sargon. I have referrals from Israel. I had a patient from Israel that was sitting there and insisted on having their teeth right away. And they said, the guy that can do it is in Los Angeles, Sargon Lazarof, and she actually came and had her teeth done in my office.
You love this whole replacing missing teeth with dental implants. Why?
Yes.
Why do you like it so much?
I think it's the holy grail of dentistry, the ultimate. What profession can profess that we can replace what we deal with actually a better piece? Okay. I can give you a tooth right away that doesn't decay, and it's prettier than what you had there. What else do you want?
Very nice, very nice. Now you have a pretty graphic photo coming up here. What is this?
Yes, this is a patient, another typical patient that came in, and this is the condition that she was in. And we, you know, the reason I'm showing the close-up of the gum is that, you know, recreating the shape of the gum and the crown and all that, this is her own gum and teeth. These are not dentures. So
using dental implants?
Using the immediate implants.
Okay.
Yes, yes. So I have some graphic pictures of the procedure. I don't know if you want to show it.
Not really.
But this is the result that we get. We have patients just come in for cosmetic reasons. Here's another patient that has mainly a cosmetic problem and one tooth that had to go. So
that big front tooth had to...
Yes. By taking that tooth out, giving implants, what we also did, we arranged his midline, which you know, affected the cosmetics of it, as you can see in the post-operative picture.
Looks very nice.
Yeah, and we aesthetically, we redid all the teeth. The lower teeth are veneered, and we gave them a beautiful smile.
So you don't, if somebody's missing a tooth or a few teeth, you don't do traditional, I guess, bridges or partials or whatever.
No.
You like implants?
No, I never like to grind healthy teeth to hang teeth off of that limits their life.
Okay.
When you take and hang teeth, eventually those teeth give out and you got a bigger problem. So we'd like to replace any bad tooth with an implant and restore it and leave the healthy teeth alone.
A new FDA-approved tooth implant system tops tonight's health check.
A study published in the Journal of Prosthetic Dentistry reported a 96% success rate with this new procedure, which has prompted dentists from around the country to come to California to the Sargon Institute for training. The system can be used for a single tooth or any number of missing teeth, and even for denture wearers. Some folks can't even believe it after they get the implant.
I had a sandwich after hour and a half after the implant, but I still cannot believe it.
Knowing you were going to come on the show, on the internet it says about 500,000 people in the LA County have an upper or lower denture. And you say you can go in without teeth and leave with teeth with dental implants. Why aren't they all doing it if it's so good?
Well, number one reason is probably that they're not going to the dentist, because once you wear dentures, and they don't find a reason to go to the dentist, and so no one is telling them that there's a better way to do things.
Okay.
The other thing is that whoever's in dentures have probably experienced all the pain of the root canals and restorations, failed teeth and all that, and they think of associated dentistry with that, and they think, forget it, I'm done with it. But if they know there's a technique that can, in a single visit, lock those dentures in or actually give them all their teeth back, they will do it, and like many people that come to my office and do it.
Okay, good. For people just tuning in, we're talking to the inventor of the Sargon implant. It's the only FDA-approved, you say, immediate
Expandable
loading
immediate implant. Yes.
Okay. And so, and you teach other dentists, is that right?
Yes.
How to do this procedure?
Yes. I've taught many dentists worldwide to do this procedure, and so there are other people that do it. But if people specifically seek me for the procedure, I'm in LA.
Okay. You brought more photos. What else are we looking
this is
at?
another case that front two teeth, because of gum disease, they were loosened up and they had to be taken out. So her option was destroying the healthy teeth next to it and putting a bridge, or taking these out and waiting for months for the area to heal, and then gum grafting, bone grafting, placing of implant, but 14 months later to get two teeth, or to walk out with two immediate Sargon implants, and that's what she got. You can see the picture after.
It's very nice. And those don't come in and out?
No, those are just like your own teeth. They're cemented.
And you're like the only guy doing this in LA, or one of the only guys?
I am the inventor of the technique.
Okay.
Yes, Sargon implant is Sargon, my name. So,
you named it after yourself?
Yes. Because I invented it 25 years ago, and I've been doing this procedure for 25 years, and thousands of patients have had this procedure, and I have cases that go back 25
we
years.
are short on time, but what should somebody look for in a dentist that's going to be doing like dental implants for the denture wearer, or somebody missing a single tooth? What do they want to know? What do they ask?
Well, you can take a weekend course and become an implantologist, but it's very important for the patient to find out how much experience the dentist has, how long they've been doing it, and what do they know about the procedure. And this is very important because understanding bone biology and technique and all that, it takes time, it takes experience. So, in finding the guy that is experienced is easy just by asking the question. How long have you been doing this?
And it doesn't cost more
No.
to go to a guy that has a lot of experience.
Yes.
Because when people always go to my website, and and we're not a referral site, say, who should I go to? I said, well, find out their experience.
Yes.
Whether it's a facelift or anything. How many have you done? Is that an embarrassing question, I guess, to ask?
Absolutely
Like to say,
not.
Doctor, how many have you done? You've done thousands?
Yes, and the patients come to me is because they want to go to the inventor, the guy that actually created the technique.
Yeah.
So
You're like the dental implant king in a way. I mean, if you invented this,
the immediate implant.
this immediate implant.
Yes,
right?
the term immediate implant, as I said, was coined by me. I was the first guy that actually, implants years ago, they were all immediate, but they were not successful.
They would fall out?
Yeah, it would fall out. There was only 15% success rate with putting screws 70, 80 years ago. They would put screws and put a tooth on it right away. They would fall out. So they were not accepted as a mainstream of dentistry. Until in the 80s, a doctor from Europe said that you have to bury these implants and let them heal. So bone would osseointegrate. And that's when implants became predictable and more common. But I'm the guy that said, I can achieve that osseointegration immediately without the waiting period. But with this implant, which is the only implant that can expand and is FDA approved for doing so, and lock itself in bone and be loaded right at the time of placement.
So same day tooth replacement, no more dentures
Yes.
at all.
Yes, that's the news.
Over to the denture wearers again. If a denture wearer goes to your office, they've been in dentures 10 years, 20, 30 years, what are their options when they go to your office?
The first option is putting a minimum of 4 implants and locking the denture in. And the reason I say 4 is because I like my tables to be on 4-legged.
Okay.
You can do it with 2 legs, but it's not stable enough. So 4 implants, it snaps in, snaps out.
Full arch of teeth?
Full arch of teeth, and you can lock them in. Only for cleaning, you take them out, you brush the implants, clean the denture, and put it back in. So just by these 4 implants, having the denture locked in, there's no more adhesives necessary. They can chew much better. They can put a lot more pressure on food. Regular dentures can put 25 pounds. This is much more. They can chew much more fibrous and improve their diet. And obviously by putting more implants, you can lock those teeth in so you don't have to take them out. But it's basically up to the patient and what their expectation is, and we give it to them.
What's the next level up?
Next level up to put 6, 8, 10 implants depending on the size of the jaw. And if it's male, female, and the strength of his jaw, obviously we want more implants. Depending on the age of the patient, ideally you would want 1 root per tooth. So you're not hanging any teeth off of anything. So always the more implants, the more stable, and the longevity of the case is much longer. So if some young patient comes in and they've lost their teeth and they want all their teeth back, they would need 10 implants, 12 implants, 1 implant per tooth.
So that's what everybody wants, teeth that don't come in and out of their mouth. What could they eat? Whatever?
They
Even
can
hard
have
things?
anything they want. As I told you, we give them an apple to bite on right away. They can have steak, al dente pasta, and sometimes I tell them they can bite off the corner of the table because these are metallic teeth. But psychologically, it's so important when you have your own teeth, you smile, you don't hide your smile. Many of these patients that go around, you don't see their teeth is because when they smile, they have their teeth, they have their hand in front of their mouth. So the security of having your own teeth back is tremendous, and those implants act to maintain the jawbone that supports the muscles of the face and gives you a younger look. Because as you lose your teeth, you lose the jawbone that supports the muscles, and you start shrinking, and a lot of people keep stretching and stretching their face. Instead, they have to, if they fix the substructure to maintain it, you don't have to do that.
Okay, good. We have time for a couple more photos. What are we looking at here?
Okay, here's a patient that walks in, a young girl, beautiful girl, with 4 teeth that had to be taken out. You can imagine the depression that she was experiencing, being told that 4 front teeth have to be taken out. She had an option of something removable, a partial denture. A bridge would be too long, it wouldn't last too long. And typically she'd have to take those teeth out with the regular dental implants and wait for months and months until the bone healed and grafting and all that, and put the implants. So she still had to go out with a removable type of restoration for months. So she was depressed, but in our office, what we were able to do is take these teeth out, give her 4 implants in a single visit right there, give her 4 crowns. These teeth look great. We work with wonderful, great labs that do excellent work. We match her teeth to her own teeth, and she walked out speaking, talking, and smiling, and eating anything she wants.
So same day.
Yes.
What do they say when it's all done and they're all healed up? What are some of the...
The biggest comment I get is that I couldn't believe it. Now I'm a believer. You know, even though I've gone through it, I tell them about the procedure, I tell them how it's going to work, they cannot believe it. They actually start telling me how they went home and started eating, and they had how little pain
They tell you eating stories?
Absolutely. I want to hear those stories because they brag about their eating because they weren't able to do that. She wasn't able to chew. These teeth were loose. She couldn't chew with them, so she was ignoring them for a long time. She was hiding them. She couldn't smile. So all of that changes in a matter of a couple of hours. And that's possible, and we can do that.
So transform your life in a couple of hours.
Yeah, absolutely.
You told me that some patients almost get angry. How come nobody else knows about this? This is what you said.
Exactly.
They say this to you?
They say it all the time, and it's your job to let everybody know.
So that's what they want.
Yes, yes, that's why I'm here, and I want everybody to know that this technique is available.
So, and what do you call it? Okay, so is it same-day implants? Is it immediate
It's a
tooth
Sargon
loading?
immediate tooth replacement system.
Okay, so same day. Even if you have bad gums?
Those are the majority of patients have bad gums because the teeth are infected, loose, and bad gums, infection. That's why the teeth have to go out. And those are the patients that we treat.
You get celebrities? Because a lot of times celebrities are in a hurry. Everybody's in a hurry.
Yes, absolutely, absolutely. Those are the guys that come in and they don't. I mean, we have patients flying from ships, boat captains that they've docked and they can't be not at their work for days and months. They come in, next day we send them back. And I have the laboratory work overnight to do the crown.
Is that right?
Yes.
So the guys making the teeth, they're doing it in the middle of the night.
Yes.
And they can come back the next day. That's for the permanent ones.
Now the great news is that now the technology exists where we actually image the implant. We don't have to take impressions. We image it, we push the button, it goes to the laboratory, which the laboratory is in our location. Computer starts grinding the tooth. We take the tooth. Hours later, we give it to the patient.
Okay, good. So we are out of time. Somebody watching this, maybe the denture wear, or all of their teeth maybe have to be pulled out, but they're still afraid, or they're skeptical. This same day thing, maybe they're not sold on it, or they don't believe it, or they're afraid of pain. What do you tell them?
First of all, what they can do is contact our office. We'll put them in contact with patients that have been doing this for years and years and have had these procedures. They can go on the internet and check all the information that is available on this technique. And the great news is that it is possible. I mean, when I woke up 4 o'clock in the morning and thought of this idea, I dreamed of this day. And this day has been here for 25 years. I've been looking at these patients in their eyes, the glory of having their teeth back, their youth back by their teeth. So it's a wonderful feeling that I want to scream out loud and tell the world that it's available for everybody.
In fact, you told me when you invented this and found out that it works.
Yes.
You ran down the street or something like that.
Yes, it was on Beverly Drive and ran down. They thought this doctor has gone
So you
crazy.
were happy.
Yes, yes.
25 years ago.
Yes.
Well, good. So you've changed the world of dentistry.
Absolutely.
When it comes to dental implants. We're out of time. I want to thank you for coming on the show.
Thank you. Thanks for the
And if they call you, they can meet with you or one of your associates that work with you.
Absolutely.
Is that right?
Yes. Yes.
Okay, great. Thanks for coming on the show.
Thank you.
You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.